Today, I would like to mention a few points about the Hydrafacial device and how we are incorporating it and how we are using it to boost our practice here in Clinica Jewel in the lovely city of Abu Dhabi, UAE. I was introduced to the Hydrafacial machine somewhere like 5 years ago. And the first time I saw that machine and I tried it myself, I immediately fell in love with it. And in my own personal opinion, actually, the name facial isn't quite enough giving the actual description for the activity or the impact that this device do. I never consider it as a facial because as we all know, facial word means a lot of things. I mean, plenty of customers come in by the clinic and they say, yeah, I do skincare, doctor, I do facials. And when I ask them what type of facials or what kind of facials you're doing, most of the time I get the answer of, you know what, I do the facials with in my salon whenever I'm having a haircut or in the spa. So actually, if we want to be more practical and we want to be more professional about it, you cannot compare the activity or the Hydrafacial machine and what it can do to a normal facial. So, when I tried it on myself, I've discovered that this machine has the potential to enhance and rejuvenate and boost the skin layer in ways that a normal facial cannot do that. And I will elaborate more during my talk about the versatility of this machine and the diversity and the other things that you can incorporate into the cycles of this machine that could enhance it and make it more easy to use and more wider range of usages. The important thing I would like to mention here about the Hydrafacial, as a device, your medical staff, any one of our medical staff, can easily be taught how to use it and how to go through each phase and each cycle of the device. But believe me, as a small tip from my side, it's very important whom you choose as a staff to operate the Hydrafacial, because there's a huge difference, as I have come to notice, between my staff, that the operator of the Hydrafacial, if he is doing the session with a passion and the knowledge, the results would be quite remarkable. But if the performer of the device is just doing it in an automated way, just following the instructions on the device, step 1, step 2, step 3, just like that in a robotic way, and there's no passion about it, there's no enthusiasm about that machine, the results will be different. Now, why am I saying that? For a very simple reason, because when the operator of a Hydrafacial is actually very passionate about this device and very enthusiastic about this device, he can actually come up with so many things that can be added into the cycles of the treatment, or that can be adjusted, like taking out some of the cycles and according to the skin need of each individual, of each patient. As we all know, our patients are different. Each skin type is different. There's the oily skin, there's the mixed type skin, there's the dry skin. Each type of skin needs its own protocol and its own technique to be dealt with in the Hydrafacial. And even further than that, our expert, for instance, our expert beauty therapist, she goes even further than that. She adds more things into the cycle of the Hydrafacial. The Hydrafacial cycles are so versatile, they are so wide. you can actually tailor tuck it into your own needs. You can add so many things into the cycle of treatment, adding vitamins, adding minerals, adding mesotherapy, and sometimes. So that's how I've come to realize that the operator of the hydrofacial needs to strongly believe in it and be quite passionate about it in order to achieve a maximized result out of it. On how we are incorporating the uses of the hydrofacial device into the practice in our clinic, whether it is a non-invasive procedure or even the plastic surgery procedures that we are doing. For instance, let's discuss it as for the patients who visit us for the first time, and we call them the first-time patients who come for their first time in life for a cosmetic clinic, seeking out the medical advice from a professional part or a professional clinic, and asking and seeking the enhancement and the rejuvenation of their face. Whether it is going to be an invasive procedure or non-invasive procedure. Now, after doing the interview with the patient and going through all the medical history and doing a complete analysis of their facial features and their skin type, and then we reach to a decision that whatever the patient needs, whether it's going to be a non-invasive like Botox, fillers, threads, or other types of non-invasive procedures, before starting with these procedures, I usually formulate a total plan or a master plan for the patient. I start by elaborating the actual benefits of having a total care program that starts actually with enhancing and hydrating the skin, which means incorporating the use of the hydrofacial. And I go further down and I explain to the patient that in order for her to get a maximized result out of her Botox or out of her threads or fillers, in order for her to get that maximum result, it's better for us to start by preparing the outer layer, the thing that everyone has the eye on, the skin layer. We need to prepare that layer, make it fully hydrated, glowing, healthy, and rejuvenated. So once we have that in order, then whatever we are doing of the non-invasive, like the Botox or the fillers or the threads, will actually be maximized, and the results will be even more impactful on the appearance of the patient. So eventually, when combining these together, as I've seen in my own personal practical experience, the patient will be really satisfied and much appreciative of what they are getting of these results. Now, obviously, doing the Botox or the non-invasive procedures alone will definitely give the required results. But what I'm talking about, and especially with the first-time patients, is how to maximize and how to push it to the extreme benefits of these procedures. And that's how we incorporate the hydrofacial device with the non-invasive procedures in the clinic. That's for the first-time patients. Doing a hydrofacial for one time only would give no actual long-term results. Because if we want to maintain our skin, if we want to have our skin hydrated, rejuvenated, doing one session wouldn't do the trick. Obviously, our skin has been long time with us since our birth. And the thing that's been subjected for our skin, like the temperature, the humidity, the dust, even the frequent use of makeups, all these things are damaging to the skin. Now, to expect that you're going to have a wow effect or a remarkable result after one session of a hydrofacial, that would be unjust. Obviously, what we need to do is at least doing the full cycle of one regime or one protocol for a hydrofacial machine. That protocol is 5 sessions, whether be it in the first couple of sessions, maybe separated by a couple of weeks, and then taking it on, like the 3rd, 4th, and 5th session may be separated by once a month. Only then, and only at that time, by the 3rd session or the 4th session, the patient will start realizing the benefits of the sessions that they are doing. The patient will start telling me and giving me a feedback of, well, you know what, doctor, I did take your advice, I started with the hydrofacial, and now I can tell you after doing the 4th session, I can actually see my skin is looking more brighter, more softer on touch, and it looks more hydrated. And you know what? The trick about that is it's not only about the activity that the hydrofacial can give during the treatment process. No. One of the main things that the hydrofacial can do, in my opinion, is that it adjusts the skin. It gives the skin the boost or the impulse that this skin will become so clean. The pores will be cleaned up out of the clogged material, out of the sedimented material like frequent makeups, dust, humidity. Sure, you can take the outer layer by doing your facial cleansing at night. Sure, you can remove the outer clogged material from these pores by doing the water and soap at night or at morning. But believe me, the deep down material that's been sedimented over the weeks and months and years, inside the deepest parts of the skin pores, these will not be removed by regular washing up or regular using a facial cleanser. These sedimented material needs to be emulsified and suctioned out. And as far as I know, the only machine that can do that is the hydrofacial